Good morning, everybody. Welcome to Edge Radio and the Rodriguez Rejuvenation Show. Here's where you get all the information you need regarding aesthetic procedures, cosmetic surgery, anything you ever wanted to know about in terms of looking younger, looking better, and also feeling better. This is where you come to get the information because you're not going to get it from your primary care doctor. They're too busy trying to make sick people well, including yourself when you come in with the cold or with the corona. I'm joined by my lovely hostess as usual,
Hey.
Miss Sarah Ross.
How you doing today,
And since I didn't mention the corona, I do want to let everybody know out there as a medical professional, it is my obligation to inform people. Right now, corona is as contagious and as dangerous as it's ever been. We've had, we were talking about an article that's here in the Houston paper about 4 hospitals had to turn away people because they were overwhelmed with the number of people showing up. We've had a record number of cases.
And this has been recently, Doc?
This is today. Today. This past few days, we had the record number of new cases and hospitalizations and ICU admissions that we've ever had for corona. So I want to caution all of you out there as a medical doctor, okay? We've had some very socially upheaving events that have occurred recently with the death of Floyd and with subsequent protests and rioting and everything else out there. People are very easily distracted. Floyd's death, protests, rioters, police brutality, or police love. None of that matters to corona. So, just word to the wise, you guys be vigilant, be careful, still practice good social distancing, hand washing, and other techniques that you know will help decrease the chance for contamination or for infection.
Doc, if I'm out protesting, how can I protect myself? Technically, I'm out with 1,000 people. We're in close quarters. What advice or what can you provide?
Well, if you choose to do that, you know you're going to be at risk because people are yelling and spewing saliva in your face. So if you're going to do that and be involved in those close proximities, if you're just walking down the street and you're social distancing, that's one thing. If you're standing with a bunch of crowds, people up against the barricade and somebody spitting on the back of your neck, that's a different thing. But you put yourself at risk, and you have to weigh the risk versus the benefit of what you're trying to do. At the very least, wear a face mask. Wear gloves if you have to. Take your clothes off after you finish marching in the protest. Put them in the washer and dry them off and wash them before you start hugging your loved ones at home. You have to use good common sense. All the things that applied, before the protests are even more important now.
Well, let's not forget the people who keep on their gloves. You have your gloves on all day. You touch so many different things, and now you're in your car.
No, the gloves, all the gloves do is they just protect your fingers from contamination at that point. Gloves do not prevent the spread of anything because you can rub corona from one point to another, from one person to another, on your gloves or on your hands. So unless you're washing the gloves every time you touch something, the gloves are just transmitting the virus just as well as your hands. You might as well not wear gloves. Gloves are ridiculous if you really want to know the truth. Okay?
Well, pretty much you're telling people stop driving with the same gloves that you're out protesting with.
Hello.
And the mask as well.
Or the same ones, gloves that you were in the grocery store fingering all the packages that everybody else was fingering, and then you wear those gloves and get back in your car and you start rubbing your nose. First thing you do is you grab your mask and you put the hands on your face.
Exactly.
I mean, come on now. You gotta, people, just please use your head, use good common sense, okay?
Capiche.
The protests, the demonstrations, none of that has scared away Miss Corona. Okay? So.
Can it be a mister? Why does that have to be a miss? Blame everything on a woman.
It's a female name. All right. But anyway, let's get to something that's a little bit lighter. You want to go someplace where you're safe. You want to practice good social distancing. You want to go someplace where there's good hygiene and disinfection and all that. There's no better place to come than Rodriguez Rejuvenation and get some liposuction done. Because when I'm doing your liposuction, I have got a mask on. Mm-hmm. Hello.
We see.
I've got a gown on. I've got goggles on. I have a robe on.
Full PPE.
And guess what? My patient is sitting there all covered up too. With only her little belly showing or the flanks or the whatever it is that I'm working on. There's no better place to protect yourself than on Rodriguez Rejuvenation OR table, getting your fat taken care of today. So that's what we're going to talk about. We're going to talk about liposuction today.
What are some of the myths about liposuction?
Well, there's lots of misconceptions about liposuction. People think that liposuction is a be-all and end-all to getting the figure that you want. Mm-hmm. No. Liposuction is a body contouring procedure. What I do with liposuction is kind of smooth out the rolls, smooth out the overhangs. A common misconception is that liposuction is a weight loss procedure, which it isn't. Mm-hmm. Okay? People need to do the things that they would normally do to lose weight to get to a smaller size. One of the unhappy patients, thank God I have very few, is one that I had many, many years ago before I got wiser. She was a heavy lady, weighed 230-something pounds. I did the most fat removal that I've ever done on anybody. I took away 8 liters of fat, and the American Society of Aesthetic Plastic Surgery says 5 should be your limit. But since I do everything with local anesthesia, I was able to safely take 8 liters. 8 liters is
equivalent to
about 2.5 gallons.
Okay. Milk jugs?
Yeah, the 8 liters is a lot.
Wow.
But 8 liters of fat weighs 16 pounds. So when I finished the procedure, she went from 232 pounds
to Miss Coca-Cola
down to 218 pounds. She was still big and fat, and she was unhappy because she thought liposuction was going to make her fine. Okay? It doesn't happen that way. That's a common misconception. Liposuction is a body contouring procedure and not a weight loss procedure. That's why when patients come into my practice to want to be a smaller size, what they really want is people don't want to shrink to a little toy doll. People want to be slimmer. People want to be smaller. They want to be shapelier. Mm-hmm. And part of that has to do with losing weight. So one of the things that I do with all of my patients that are excessively heavy, and after listening to them and what they really want in terms of the end result, I said, we need to get you on one of our medical weight loss programs, under my supervision of my staff, to get you to lose 20, 30 pounds. And then at that size that you said you want to be, and doesn't have to be skinny, but it's a healthier size that you feel you look good, you feel good, that you can realistically maintain. Then at that size, we can look and see what's disproportionately large, and I can reshape that area and make it look nicer with surgery.
Nice. Yeah. Nice. I also heard that a lot of the misconceptions possibly that it is liposuction is a good tool for weight loss, but once you have liposuction, the fat does not return. Okay,
that's another common misconception. Let me qualify that, okay? Fat cells are merely storage pockets, if you want to consider them storage pockets, for excess calories. When you put more calories in your mouth than your body is going to burn or use, you have to store those calories someplace. Those calories are stored in fat cells. Mm. Now, if the main place that you store your fat cells, like it's around your belly, that's the most common area for both men and women. If that's the most common area, I can physically remove millions and millions and not billions of fat cells from that area.
Wow.
Okay? Now, I cannot remove all of the fat. Okay. The body just won't give it up, no matter how much, and you don't want to. You want the skin to move and naturally over the muscles down below, over the bones. You don't want the skin sticking down onto the muscle like a bullet hole, like a gunshot wound.
You mean like saggy?
No.
No.
You want the skin to be smooth over the area where the fat was removed. Okay. Now, it's important to leave behind a little bit of fat, because that little bit of fat, that little cushion that's left behind, is going to make that area feel natural. It's going to make it soft, and it could avoid a lot of irregularities like a lumpy, bumpy look or lumpy, bumpy results that sometimes results from the surgeon being overly aggressive at trying to remove the fat. So that's also a matter of technique. So once again, all liposuction is not the same, and as we mentioned on other shows, all car mechanics aren't the same. All aesthetic plastic surgeons aren't the same. So it does involve using good technique and having a good grasp of what you're trying to accomplish for that particular patient. Now, having said that, the fat will never, if you maintain your weight, the fat there is not going to grow into more fat cells. Okay?
Okay.
The fat cells that are still there, if you gain 30 pounds, that area is going to look fatter again. Because those fat cells that I couldn't get out, they're plumping up. Okay?
Twice the size.
They're plumping up, let's say twice the size, just for the sake of discussion. So that area will be fatter. The fat did not come back to the area, but the fat cells that were left there are now storing more of those extra calories that you've been shoving in your mouth since we got rid of your problem area. Okay?
Now, is liposuction painful?
No. But let me talk a little bit more, because another common misconception is that people will sometimes say, yeah, I had lipo here, but after I had lipo, then, the fat went to my arms, or the fat went to my hips, or the fat went to my butt, or the fat went to my back, where I got rolls sticking out above and below my bra. The fat didn't go anywhere. The fat, only place the fat goes somewhere is when Dr. Rodriguez takes it out and puts it in someplace else, like with the natural breast augmentation or Brazilian butt lift, which we talked about, or use your own fat and move it to a different location. Fat doesn't go anyplace without Dr. Rodriguez moving it, okay? What happens is, since I took care of your favorite pockets, let's say your belly, where you store the fat, that was your favorite place where you stored all those juicy calories, Dr. Rodriguez kind of sealed off that pocket. So you can't store the calories there like you used to. But you're still shoving calories in your mouth at the same rate.
Yeah.
Guess what? Fat cells over here in the arms say, hey, come over here. The ones over in your thighs. Hey, come over here. Dr. Rodriguez didn't get us. We got lots of room for you, Mr. Calorie. See, I'm now using a masculine. You don't want me to use a feminine name. I gotta say, come over here, Mrs. Calorie or Miss Calorie. Come over here, Mr. Calorie. Dr. Rodriguez didn't touch us. We have lots of room to expand and blow up, and we can store all those extra calories that are getting shoved in the mouth. So other areas will get bigger if you don't take care of yourself afterwards.
But now, you said, okay, Dr. Rodriguez, you take some out and you put it someplace else. So if I come to you in January and I'm saying, Doc, take these love handles off. It's just too much for me. But I don't have enough money right now. So can I come back to you in July from the fat that you took out from January and put it in my breast in July? Does it work like that? Can you freeze it?
No.
You just got to take it out and use it at that time.
There are some places where there are fat banks and they store the fat and all that. But the problem is that when you thaw the fat, it's not as viable, it's not as hardy, or as likely to survive. The best chance to have the fat survive when you move it from one part of the body, let's say from your belly to your breast, or from your belly or waistline to your butt, is to do it right there on the spot when the cells are alive, they're fresh, and we do it all at one time at the same procedure. You're going to lose a certain amount of those fat cells anyway. Not all of them are going to survive, but the best chance of survival is to get them while they're fresh and put them in the new location right there in your own body right at that time. Okay. Now, back to what you said about painful. A lot of people think that all surgery is painful. Some liposuction can be very painful. But the way that we do liposuction and Rodriguez Rejuvenation is I use local anesthesia. I don't use general anesthesia, and that's another misconception, that it can be dangerous. And one of the things that makes it safe in our practice is that we use local anesthesia. We give you some little happy pills to help you relax, but the whole time you're talking. If I say turn to your left, Sierra, turn to the right, you're able to follow my commands. And guess what? When I finish sculpting the parts of your body that you wanted help with, I can say, okay, stand up. And I'll have you stand up right there in the exam room, in the operating room. So if I see any areas that need a little extra touch-up work, I can circle them with a surgical marker and have you lay back down, and then I can go back to work on those areas to touch things up. Okay. That's a luxury that you don't have when you're knocked out with general anesthesia.
Yes.
Now you say, why would anybody do anything with general anesthesia? Well, if you're knocked out, you're not going to feel any pain when you're knocked out. Okay? So most of the time, big traumatic instruments are used because you can do the case faster and get the next patient on the table.
Yeah.
Okay? With big instruments. If you look at it like you can suck up a milkshake faster with a big straw than you can with a little narrow straw. Okay? So it helps to turn the room over faster. But after they pull the tube out of your throat and you wake up, you're going to have a lot of pain. Pain that requires narcotic pain medication for perhaps sometimes weeks. If you're doped up on narcotics, you can't drive, you can't take care of your kids, you can't go work in a hospital because you're going to be making medication errors.
Yeah.
So we do all of our cases with local anesthetic with a little bit of oral sedation to help people relax. That makes it safe. That eliminates completely the risk of the general anesthesia. Okay? Now, because I'm using finer, delicate instruments to be able to do it without having to knock you out, guess what? When we finish the surgery, you haven't been traumatized as much. So afterwards, you don't need to take the strong narcotic pain medicine. Over 90% of my patients can control any discomfort that they have with 2 naproxen, which is Aleve, plus 2 extra strength Tylenol, 500 milligrams each, 4 little over-the-counter pills every 12 hours will keep you very, very comfortable. So I actually have some nurses, because their head is clear, they're not taking narcotics, they go back to work the next day.
I'm sure.
So no, it doesn't have to be painful. Pain is a result of trauma, and if you can have your liposuction done in a way that minimizes trauma, you're going to have less pain afterwards to recover from.
Well, there was a myth. I'm not sure. Maybe you can confirm it. It says non-surgical fat reduction treatments are just as effective as liposuction.
Yeah, there are. That's kind of a myth, and there's literally dozens of devices out there now to reduce the fat. But let me just touch on one more thing in regards to safety and the beauty of being able to do these procedures with local anesthesia. We talked about it's safer because you don't have general anesthesia to worry about. You don't have to worry, am I going to wake up? Am I going to stop breathing? We talked about the fact that you're not going to have as much pain afterwards, so that's less downtime, less disability. You can get back to work within a matter of 2 or 3 days. But also, remember I said I can stand you up?
Yes.
If you're knocked out with a tube in your throat, the best surgeon can do is kind of eyeball and estimate what you're going to look like when you're standing. And we all know things look a little bit different when we're standing straight up in the mirror than when we're laying flat because of gravity. Okay? So, doing it this way allows me to get a better cosmetic result. Because I can sculpt and see exactly where your body's going to look when you're standing upright at a cocktail party in a tight dress, or you're working out in the gym, or you're working out the gym with a tight t-shirt. So I put you upright so I can see exactly the way that I saw you when I saw you in the examination room. Say, Dr. Rodriguez, I want to get rid of this, I want to get rid of that. So it allows us also to get a better cosmetic result. And that's one of the things I wanted to touch on. Okay?
Nice.
But everybody, because people have a fear of surgery, and some people don't want to go through surgery no matter what, no matter how safe, no matter how pain-free it might be, there's a lot of devices out there to shrink down fat cells without surgery. Now, all of these devices, whether it's freezing, like there's a common one called cool sculpting that you see commercials for on TV, or whether it's lipo lasers, or whether it's even injections of medications, which I also do in my practice. I have these non-surgical modalities in my practice for those people who don't want the liposuction. So all of those are designed to kill fat cells underneath the skin. And then the body has to gradually remove the dead fat cells. So all of these non-surgical modalities take weeks to get the final result, sometimes months, because you may have to repeat the treatment after the first round, okay? The other challenge with some of those is many of them involve putting paddles on or little plates on in different areas. You really can't sculpt the area the same way that you can with liposuction, where I said I'm sculpting the area, removing fat. If you look at liposuction done properly, it's kind of like a beautiful statue. I'm chipping away everything.
That's a nice way to put it.
That's it. Michelangelo was once asked, because I don't know if you guys are familiar with David. It's an 18-foot tall statue of this beautifully proportioned man in Italy. The statue of David is a world famous statue. And Michelangelo was asked, how did you get such a beautiful statue like that out of that giant block of marble? And Michelangelo said, I simply chipped away everything that wasn't David. So what I did, I simply sculpt away everything that keeps you from looking your best. Okay?
Doc, where can they find you?
Anybody can find me very easily. Just go to RodriguezRejuvenation.com. That's our website. And the website has lots and lots of information, much more than you can digest if you stay there for 2 or 3 weeks. Another good place is on our Facebook page, which is official Rodriguez Rejuvenation. Just go to Facebook and put in Rodriguez Rejuvenation in the search bar. On our Facebook page, we give you posts related to different procedures, new things that I'm doing, lots of videos, etc. It's also a good way to stay in touch. And you can also stay in touch with us through Instagram, because a lot of what I do is visual. So we have lots and lots of videos on Instagram that show me doing the procedures, explaining what I'm doing. So it's a way for people to get information and to lower their anxiety level. Because they say, wow, it's not that scary.
Yeah.
Oh, Dr. Rodriguez is and that patient is talking to him. So it's a way to get people familiar with a lot of the things that we're discussing today, in a non-threatening way. So when they come in to see me in the office, they already have an idea of what they want to have done, and they're ready to move forward with that. Okay? Now, I'm going to talk about another myth, which is liposuction is for rich people.
Yes.
Liposuction is for celebrities. Only people that have lots and lots of bills and lots of coin. That's not necessarily true. Okay? Most people with a stable job can get liposuction. You may not get as much as you want, but we can certainly address some areas of concern. In my practice, most of the people that I see are just normal working people, working class people. And many of those will put together their money for a procedure, but many of them will take advantage of medical financing. A lot of people don't realize that there's companies that specialize in medical financing. And what you do is you come to my office and we give you a link, or sometimes you can apply right there, just like you apply for a credit card at the store.
Wow.
And right there, they can let you know if you're approved for a $10,000 procedure.
Wow. No, Doc, I don't think many people know that at all. I didn't know that.
They don't know that. It's all based on your credit score and whether you have a job. It's the same criteria that they're usually going to give you a credit card. We don't know your finances because you go directly to a secure site where you put all that information, and then based on the information that you provide and based on your credit score and the other qualifications that they have, they'll let you know, okay, you're qualified for $8,000. And then you can pick how you want to pay. It'll only cost you just a few $100s a month. So
finance your new body.
And there you go. And we have 3 different companies that we work with. So many times when one of them isn't going to give you the financing, the other one will. The other nice thing about this is that even though they check your credit score, many of these companies, when they give you that loan to get your liposuction done or whatever cosmetic procedure you want to have done, it doesn't go down on your credit report as another debt.
Really?
So that's a benefit to using these medical finance companies versus trying to use your credit card for mileage on an airplane that you're not going to get on nowadays. Yeah. Okay?
Doc, don't say that. I want to travel.
So those are just some of the myths. And when people think about liposuction, they always think about taking fat away. And once again, we have a motto. We don't let your good fat go to waste. Okay, that's a motto that we have at Rodriguez Rejuvenation. We don't let your good fat go to waste. And like I have this gentleman that we're going to be doing surgery on soon. He's a gentleman about late 50s or so. He works out, but he's got too much fat on his belly, too much fat on his flanks. and he's got no butt.
No, he doesn't need it.
So we do Brazilian butt lifts on men too.
Oh.
Okay. Some men want to have a fuller
derriere.
Okay, just like women do. So in his case, I planned the procedure. We're going to trim his waistline by taking care of the upper fat, belly fat, the lower belly fat, the love handle. So he's going to have a more tapered V-shaped masculine look. But we're going to take some of that fat, or most of that fat, and put it back in his butt where he's got no butt. Okay? To give him a rounder, shapelier butt. He's not going to have a big butt, but he's not going to have a flat butt anymore either. So
He'll be proportioned.
Yeah, men don't want to have a flat butt. Yeah, you ever heard a man say, "God, I wish my butt was flat"? Have you ever heard that?
No, I don't think too many men want to say it publicly. I think that's more so an internal thought.
No, they don't want a flat butt. They may not say, "I don't want a fat butt," but some do want a fat butt too. We can help them with that, but they don't want a flat one. So in his case, we're going to move the fat to his backside. But guess what? He said, "Doc," he started looking at my Instagram and he saw some of the things I do with facial rejuvenation with fat. He said, "Doc, can you do something about this face and these wrinkles and that?" So we're going to take a little bit of that fat that I take from his waist and we're going to put it in his face to give his face a fuller, more younger look. He's going to look 10 years younger with just about, half a cup of fat that I'm going to put in his face in places where he's lost volumes. Restore the cheeks, the cheekbones, help smooth out the smile lines, help the temple areas fill out a little bit, raise the eyebrows slightly. He's going to look fantastic.
I can't wait.
Even when he has clothes on and people can't see his nicer, rounder butt. So those are some of the things that we can do with fat. Okay?
I love it.
A lot of people don't know that, but those are things that we can do at Rodriguez Rejuvenation with that. Now, any other thoughts that you have about liposuction or fat? Because I know, I'm talking about it from a physician's perspective when people come to me about, but, you're out there on the streets talking to people all the time and here and there, you're socially connected. Any other things that you've heard that people talk about in terms of concerns or questions that they have?
Honestly, you've actually covered a lot of the concerns. A lot has been, it's just for celebrities. Mm-hmm. The other one is, okay, it's painful.
Right.
But I really think that you opened up such a wide perspective in the sense of the financing portion. We know that we can finance a house, finance a car, do things like that.
And it's not going to cost you as much as a house or a car.
Exactly. But we don't know that is another side to medical. Yes, you can finance this thing, and if you do get approved, it's not on this credit report.
Correct.
So, Doc, I always tell you every week, you're awesome. You're very informative.
Thank you.
It's truly amazing. I think that I speak for a lot of people that want to know, hey, if I take my fat out today, can I use it in 6 months? Mm-hmm. Because some people
that's a good question.
Some people are indecisive.
Yeah, that's a good question that you asked.
Because you're like, I think I'm cute, but then you're like, oh wait, I asked him to take out too much. Can he put some back? So.
No, I don't want to put that fat in my freezer. I might mistake it for something else. But
this is true.
I'm just kidding. Fat storage is in special medical freezers. It's not in Dr. Rodriguez's freezer at the office or at the home. Okay.
Yes, no lawsuits coming through the door trying to see it. No, it's stored properly.
No, but the best way to transfer the fat is right there at the time of the procedure when it's fresh.
Awesome. Well, Doc, we're definitely almost out of time. But again, I just wanted to let you know. Tell people again where they can find you.
Once again, they can always find me at RodriguezRejuvenation.com. Make sure you spell rejuvenation properly. REJUVE, not VI. VE Nation.com, RodriguezRejuvenation.com. And that Rodriguez Rejuvenation, you can also find on Facebook. You can also find us on Instagram. And you can always call, because we want to hear your lovely voices when you call 713. That's the Houston area code, 523-2500. That's 713-523-2500. It's been a pleasure as always. Always tune in to the Rodriguez Rejuvenation Show here on Edge Radio.
Yes. And up next is going to be the Conscious Conversation Show with Ciara Russ, and I have a special guest with me. So this is going to be interesting. Doc, I'll see you next week when we get ready to do the darn thing. Ow!
All right.